Hi, everyone. My name's Jess, and this is Adelina. Welcome to the Engage podcast, Look for the Helpers. Today, we met with Dr. Rob Feeley. He's our medical director at Engage. He also has his own practice in Calabasas, California.
Today's episode talks about misconceptions with medication and medication management, medication with trauma, and a little bit about Rob's background and how he became educated in Buddhism and how he integrates that into his practice.
Yeah, he has a really integrative approach to psychiatric medication and supporting his clients.
So listen in, and we hope you enjoy the episode.
And I think we, as mental health professionals, align with how we think we can help people, but oftentimes we don't take into consideration how patients think we can help them. I realized in college that there was sort of a parallel approach where if I looked at Buddhism, it was almost like this ancient form of neuroscience. So I kind of became interested in that, and then that was a launching pad for just getting involved in other things like meditation and yoga and breathing.
Welcome to Look for the Helpers, a podcast by Engage Therapy in Agora Hills, California. Hosted by Adelina Brisbois, licensed marriage and family therapist, and her husband, Dr. Blake Brisbois, licensed psychologist. Thanks for being here.
Hi, Rob. Welcome.
Hi, thank you.
I'm so glad you're here with us. So Jess and I are excited to chat with you and share with our audience all the awesome knowledge that we get to borrow from you all the time. And just to kind of set the tone about this podcast, we wanted to invite people on that we all normally talk to and learn so much from, and just wanted to share it with the rest of the world because we feel like we're surrounded by really amazing professionals and clinicians, and actually not just clinicians, in fact, just people who we've identified as helpers. And the name of our podcast, Look for the Helpers, it comes from our inspiration, which is Fred Rogers, who talks about in the face of a crisis, his mom used to tell him to look for the helpers. And we think that's really a great way to think about things that happen. Unfortunately, there's a lot of challenge that happens in our world. And it gives not just kids some hope, but actually adults as well, to remember that there's always people that are there to help get the community out of crisis. Anyway, so the work that you do has helped us a lot in the work that we've done with our clients to get people out of crisis, but also just to maintain. So we want you to share a little bit more about who you are, but why we wanted you to be on this podcast is because we feel like you are a really unique psychiatrist and have felt that way since we met you, which is that you really take the time to explain not just to your patients, but to us about why things are the way they are, how they work. And, when we ask you a question, you don't just give us an answer. You actually make us think, and you usually ask us questions, which is how we learn. And I think it's what makes your patients feel so taken care of. So thank you for the work you do in general for us. And I'll let Jess and you kind of share a little bit more about our experience together, and then we can learn more about you.
Thank you. Yeah, and I just want to reciprocate that the honor is mine to be able to work with Engage and you, and to be part of the team has been invaluable for me. So, and it's made me a better psychiatrist as well.
How long has it been?
I think it's been about 4 or 5 years, maybe. It's been a little time.
Gosh, it has to be longer because when I met you, I was working in admissions, and that's been like well over 7 years.
Wow.
Because you had just moved here. When you started like working with us in different ways, maybe not in the role you are now.
Definitely about 7 years.
Yeah, but you had just come into town, I think,
Yes.
and I was working in admissions, and I still remember that. Like, you were just such a different psychiatrist than anything we've worked with before.
Yeah. Maybe I showed up in shorts or something.
Probably, yeah. With a baseball hat and
Which is part of what's refreshing about you, is that you're a human being.
Absolutely. First and foremost. I really like that title, Look for the Helpers, because I often ask myself, how can I help this person? And I think we, as mental health professionals, align with how we think we can help people, but oftentimes we don't take into consideration how patients think we can help them. So I think that if we always keep that in mind, it can broaden our horizons of, how we are as a mental health professional, what we can offer. But yeah, I think for me, what I've noticed is that psychiatry is obviously a lot more than just about prescribing medicines. It's about meeting people where they are. And upstream of that is allowing people to feel safe, because there are a lot of stereotypes and preconceived notions about psychiatrists, and there's a lot of anxiety, a lot of misconceptions, and fear. And it's good to have a healthy dose of fear, I think, when you're walking into the office, because you're embarking on a journey, and it's no light matter to just start a medicine. You have to really give it a lot of thought. So it involves a lot of conversation, a lot of openness and safety.
I really appreciate that, because we have a lot of families that come in and, their first thing is like, please don't suggest medication. We're not open to that, which we respect. Do you still work with families that are not open to psychiatric medication? Is there still a way that you can support them in your practice?
Yeah, absolutely. I think a lot of how I can support people is just by answering questions and being present with them, and also not making them feel like I have an agenda, but I'm there for them just to support them. And maybe that means referring them to other resources that are more appropriate, so that they don't feel like they're walking out being tied down to seeing this psychiatrist forever, but maybe that there was something better for them that I had offered them. So I think that's really important as far as establishing trust, really thinking about what's in their best interest. Right?
I agree. I think that's one of the many ways that we align in how we work, is that I think even, when we meet a family, same, we try to see if we can help them. And sometimes we can, and sometimes we're not the best fit. So you're right, working together. And that's another reason why we're excited about this podcast, is because we are working together all the time with people in our community that are better fits for people sometimes. And sometimes it's working together, right? Sometimes it's about sending someone to you and saying, okay, we're going to do our part, but Rob, can you do the psychiatry part? And we communicate. And I think that's so valuable. But it doesn't always happen. I'd be surprised that sometimes other professionals are not as open as we would like.
As we are.
Yeah.
Okay.
Strive to be. I want to go back a little bit. What brought you into psychiatry? Like, what drew you to want to work in that field?
Yeah. I think it was my own life experiences growing up in an interesting family, and also partaking in having interesting experiences outside of my family. So I had a lot of mental activities growing up. I was involved in tennis and piano. For me, they were high pressure, performative things. And really the outcomes were really determined by my mind, not so much anything else, because I was able to put in lots of hours of practice, but not the results were inconsistent, actually. And it gave me an appreciation for the value of my own mind. And so given that my mind was so interesting to observe amidst all of these activities growing up, I became interested in neuroscience. Unfortunately, it was the real motivation at the time in college was to prove myself to the world, like, hey, I'm going to major in neuroscience and show everybody just how great I am. But what I realized in the process of studying it was that, it was a really interesting thing. And I learned a lot about myself and science. But then I realized in college that there was sort of a parallel approach where if I looked at Buddhism, it was almost like this ancient form of neuroscience. So I kind of became interested in that. And then that was a launching pad for just getting involved in other things like meditation and yoga and breathing, ways that I could find to still my own mind so that I could understand myself better, which has obviously helped me as a psychiatrist because it helps me connect to other people. So
that explains a lot about you. I didn't know this. I'm glad to learn it.
And
yeah, like the grounded presence that you bring, I didn't realize goes so far.
Yeah, I think that it's just so important, not only for psychiatrists, but for all of us to have a way to manage our mind and manage stress and to relax, because we're not taught that in school or at home. So if we can,
you can teach me how to relax.
Yeah.
I'm like, am I feeling relaxed right now?
Yeah, maybe. I feel more relaxed.
How did you look for the helpers growing up?
I didn't. And I didn't even realize I needed help growing up. I actually thought everything was okay. Things were so close to my face that I thought that I didn't see anything wrong with myself or with anyone else that was perhaps part of the problem. So I only started looking for help, I would say, more in college by way of friends and different friendships initially, and professors, teachers. But it was only after college that I became really honest with myself and said, okay, I have a lot of anxiety. And I'm not even yet in medical school, so this isn't going to be a good combo. I need to somehow manage myself before I embark on this long, hard journey. So I started to just really become appreciative of different ways of managing mental health, and as I became a psychiatrist going through the different stages, I never lost sight of that fact that there's more to mental health than drugs. And so back to your earlier point about how do you work with families, well, one of them is also to talk about non-medication ways of helping people, which is to have some sort of education and imparting that to families about what else can you do, whether it's supplements or nutrition or diet or alternative things. But, I think as psychiatrists, we have to use our best judgment about who needs meds and who doesn't. And not everybody needs meds that come in wanting meds. And I think that we have to be a little, cognizant of that as well.
And knowing what you do, you're connected to multiple treatment programs in different ways. What draws you to that level of care?
Well, I kind of like doing different types of psychiatry. I've worked in the emergency room. I don't do that anymore. There's something about meeting people in a crisis that can be healing. If I can be a certain way for them in a crisis, I think that can leave a lasting impact in a moment of true despair. But I just like meeting people at different stages of their journey. And so I work in an outpatient private practice, and then I work at Engage with their IOP with you guys, and then at some residential centers as well. And it's just a real privilege to cut across all these levels of care and see people at different points in time.
Yeah, Adelina and I talk a lot about working in an IOP level of care, and we're just the first point of hope sometimes in that moment of crisis for families. And there's just something special about offering some support.
Yeah, and I think that people come to us and that sometimes they're very scared. And I think we hear a lot, nothing works. We tried everything, it doesn't work. Medication doesn't work. And there's a lot, I've learned from you that there's a lot of questions to ask in follow-up. When did you take this medication? How often did you take it? And you've helped us discover sometimes, there's a prescription for a PM and someone's taking it in the AM, for example. And it seems like a simple little error, but it ends up showing up in our care, someone's falling asleep in program, or they say they don't feel better, they feel worse. And then you kind of help us to realize, well, yeah, they're tired because they're supposed to be taking this at night. It's things like that I think are the details and slowing down enough to notice that. And yeah, when people are in crisis, they also come to us sometimes from the hospital. And sometimes they've been prescribed a lot of things to manage that setting that maybe is not applicable for at home and ongoing for management.
Exactly.
So that's another thing you've helped us a lot to help our clients to manage.
Yeah, a lot of people don't take their meds because of side effects, but you need to ask the right questions to really elicit those side effects. And a lot of patients aren't even aware of what the side effects are, so they're not even aware of really why they're discontinuing the medicine other than that they don't feel well. So we have to really ask a lot of questions about their aversion to staying on meds, which can be justified if they're not feeling well.
And there's a tricky thing, which is sometimes it takes a while for a med to kick in. And sometimes there's the side effects that start at the beginning but then dissipate after some time. So all of that education, I think, helps people feel more comfortable.
Absolutely.
And I really appreciate what you said, because I agree that it's kind of a serious matter to be putting a medication into your body, whether it's a new one or not. So I think that alone really makes people feel respected when they feel like, okay, my psychiatrist respects the fact that this is my body and, you know, we're going to be cautious about it.
Absolutely.
Working with adolescents, something that we do at Engage is we treat the whole family. It's not just the adolescent coming in, doing the therapy, and then going home and just being better. We incorporate family therapy, parent groups, assessments with the parents as well. How do you involve the parents into this process, or do you just meet with the teen?
Yeah, I typically work with people who are not younger than 16 or 17.
Mm-hmm.
So of the 16 to 80-year-olds I work with, I would say the vast majority, the greatest percentage are above 18, in which clients will either sign a release allowing me to talk with their families or not. So if they don't allow me to talk to their families, then I'm not talking to the families. But if they do want me to talk to families, it's just simply taking the extra time to answer their questions. And, oftentimes I think they just want to feel heard and have an understanding of my thought process and make sure that I know that they know that I have their best interests for their child. And so it's really just, again, a matter of trust, listening to them and making them feel heard. So that's the biggest thing. And I can't do what you guys do. So I am so grateful to have you in the background as a means to provide that comprehensive support to families, because what's clear to me is that you care so much, care deeply. We've talked about this over and over again about how you differentiate your program from everyone else in the Conejo Valley, probably in Southern California and beyond, but the level of care is really palpable. And that's why we align, right? Because we truly care about people. So
I agree. We do.
Yeah. I think that the work seems, we do hard work. We do a difficult job. We see people in difficult times. But I think when my family or my friends ask me, like, how do you do this stuff? You're working with suicidal kids and kids who are really not okay, young adults that are not well. I think that when you do it for that reason, it doesn't feel so draining. It actually feels really powerful. And in a weird way, it feels, it's very fulfilling. I guess that's what it is. But it only works when you are aligned with the other people that are doing it as well, so that the families can feel contained and there's consistency. I think that's the other piece, is that people come to us and they haven't experienced consistency in the mental health field, and that gets people a little down and a little negative on mental health. Like when I say it didn't work, it's not working, they're not getting better. We hear that a lot from families and from clients, actually, right? Like young adults, I think sometimes by the time young adults get to us, they're a little down on the stuff. Like I've been seeing a therapist for 10 years and I still feel this way. But our hope is to be a little different.
Well, and if you think about young adults, they are in adulthood, but they are post-COVID from being a teen.
Yeah, that's true.
When they were 16 or 17 in 2020, now they're 22, 23, and they had such a different teen experience than most. So I wonder if that comes up when you meet with them, because I definitely know it comes up in our young adult group, just processing, being home, being online for school, and what that did to their mental health.
yeah, I think it definitely comes up. I think the broader theme that comes up is like self-efficacy and self-confidence and self-esteem and feeling capable. That's a big thing that I see across the board as being like this common denominator for a lot of mental health troubles, which is not feeling good about oneself. And how that ties into COVID, I'm not sure, but I don't think COVID made it any better. But I wanted to touch back on a point of what you said about our work is an expression of who we are. I think that that's what gives people hope, and that's what people can latch on to as far as starting to feel better about themselves, is that there are people there whose work and whose mission is to be an expression of that hope for them. And for us, it's not about what can we get from our profession, how much money we make or how much, recognition we have, but it's more about what we can give, right?
Mm-hmm.
And I think that's an interesting concept to actually talk about with clients too, because I would imagine that, especially for young adults, that in this day and age in social media, it's all about what can I do to make myself appear and look in a certain way.
Mm-hmm.
And I think that's also a big driver. And I think COVID magnified that
Mm-hmm.
because when people were home, they were more often to be on their devices. There was less social connection, so they looked to social media as a form of social connection.
Yeah.
And if they didn't already feel good about themselves, social media might have made them feel worse.
Right, because you compare to what other people are putting out, and we know what people put out on social media is not the whole picture.
Mm-hmm.
So that's hard. Even as an adult, I think it's hard to not compare. So, you're having a bad day, and then you see somebody like in Italy on the bridge, enjoying a gelato, and you're like, it's just hard.
It is hard.
And then if you're a developing mind, like you said, and you're maybe we're isolated during those years that were really important, then it makes it even harder. I think I've had this conversation like 3 times this week about COVID and how I actually think any age was difficult during COVID, and we're seeing it, kind of later. We can look back. Hindsight's 2020, right? It's easy to look back and be like, well, what if we didn't have the pandemic? Would this person be any different? There was a time where I was doing admissions, and almost every client, when I would ask, when did your symptoms start? They said COVID. Mm-hmm. And it got me thinking, did their symptoms actually start in COVID? Or did they notice them in COVID? Or did they get worse in COVID? Because, and we can't know. And I would ask, but most of the time, parents and the kids would say, I'm not sure. Because how can we know the difference? I'll say even for myself, I had a tough couple of years during COVID, but was it because of COVID or was it because it was a tough couple of years or both? We don't know. But it's definitely a time in history that we now can mark as like pre and post. Are we post-COVID? I don't know.
I feel like I didn't even.
Good question.
My experience of it, I was working in residential at the time, and so it didn't stop. Like I had this paper that made it okay for me to drive, and I would still go to work, and we were still having clients come in because they needed residential support. And so my experience of everyone else was they were sheltering, they were getting groceries delivered, they were doing all the things that everyone had to do. And I was just like still doing my 9 to 5, working with these kids that were really struggling. And so it's so interesting for me to try to experience and empathize. I mean, I can empathize, but really try to understand because I didn't I had a really different experience of it.
I remember talking to you and being super jealous. Like you were driving to work, and I remember being like, oh, I miss driving to work.
I mean, hindsight's 2020, right?
Yeah.
So I don't know. But it was definitely interesting. I mean, even the clients that we got in residential during that time had a different, precipitating event or thing that really made it hard for them to stay safe or need more support.
And during that time, I'm curious what you thought, but our experience here was kids wanted to be in higher level of care. For the first time ever, they were begging to come.
Yeah.
Whereas normally, there was soccer and
any excuse to get out of the house.
Yeah. So for the first time ever, it was the kind of flipped for us where people, because it was the connection, the need for connection was so strong. And we were in person too, but it was just, it was different for us because everyone was going back home. You guys were more, in a contained environment.
They didn't want to leave.
Yeah.
They're like, I don't want to go home and shelter in place and do school online.
And not be around peers.
Not be around like 12 other teens my age. Mm-hmm. I don't want to do that. I want to stay, which was kind of such a different experience than typical.
I was just thinking, I'm going to shift gears a little bit.
Yeah.
I was just thinking, we didn't really give a background of who you are and what you've done and how'd you get here.
Yeah.
We talked about your childhood, but we don't know who you
I
are
always talk
now.
about my childhood.
We kind of skipped the part of what? How'd you get here?
Yeah. So let's see. So I'll kind of weave in some factual stuff and maybe some more personal stuff. So, Growing up, I was just always interested in, I think, understanding people. I found that my role within my family was one of discerning how people are feeling, and being aware of that, and making sure that people were okay, and being a helper, and not so much a caretaker, but just lending an ear. And so I think that combined with my interest in the mind just led me down a path of psychology. And so I was actually in college at Amherst College. I was sort of like going to major in psychology, and then the world of physiology and biology, opened my eyes to greater possibilities. And the idea of a psychiatrist was interesting to me. And I actually went into medical school, believe it or not, knowing I wanted to be a psychiatrist.
Which is rare.
I don't know how often that happens, but maybe it happens often. I don't know. But part of it was because prior to med school, I was working at MGH, Mass General Hospital, doing an internship. And I worked in a bipolar clinic, and it was a clinical trials clinic. And I had to learn how to administer the SCID and the KSAD, which are two diagnostic clinical interviews to diagnose people with bipolar or rule people out as not having bipolar. And so I remember there was a little 11-year-old kid, and he was with his grandmother, and he was trying to enroll in this bipolar study, and his whole family wanted him enrolled because he had tried all these bipolar meds, but nothing was helping. And while we were in the waiting room, this little child, sadly, was taking her mother's cane and trying to stab her grandmother's cane, trying to stab his grandmother's foot, because he was very angry and kind of dysregulated. But meanwhile, he reflected some remorse in the waiting room, like, sort of, I don't know what I'm doing. I don't know why I do this. I really want to be part of your study. And it turned out that we had to turn him away because it was deemed that he had a different diagnosis. And an 11-year-old who was heartbroken in the waiting room, and it felt like I was the decision maker, even though I really wasn't, but he looked at me as a decision maker, and almost as if this fateful opportunity had passed him and that I had failed him. So for me, in that moment, working as a research assistant in this really amazing institution, having failed this little kid and probably changed the trajectory of his life, not intentionally, but just unwittingly, feeling helpless and powerless really made me feel like, okay, if I'm a psychiatrist, whether or not I work with kids, how can I make these sorts of experiences more powerful in a better way for people? Like, how can I do the best possible job as a healthcare professional, rendering the best possible diagnostic, treatments, and I guess just really wanting to help people and feeling that moment translated in a big way for me. So anyway, I went to medical school, was really fascinated by all the different populations I saw. I really enjoyed working with veterans who were overseas, who at a VA hospital. I went to Yale for residency, and I worked at a VA hospital affiliated with Yale, and it was just such an amazing experience getting close to those veterans and really understanding their experiences and the way trauma works, and also seeing how medication interfaces with trauma, and looking at how meds failed people and how meds help people, and then incorporating other things to help people like alternative treatments. But I've just felt so blessed and honored to be able to be in this position where I can share in the most vulnerable moments with people. And I think you would all appreciate that as well. It's been such a gift to, just get to know people, make them feel safe and heard and comfortable, and help them leave feeling like their connection to mental health treatment is restored in some way. It's like I feel safe, I feel better, I feel like I want to go down a path where I can trust people.
Yeah,
right?
Things can be better for me.
Exactly.
Can you tell us more about the time with the veterans and the trauma, and how trauma and medication do or don't sometimes work together?
Yeah, it's so tricky, and I think that this speaks to the general limitations of meds. But in the Vietnam veterans whom I worked with, unfortunately, as residents, we would rotate every year. So we would get to know them, and it would be heart-wrenching for them because eventually we'd have to leave them, and this was the same thing every year. And they're already a little reticent. They're already
Sure.
really like, not to, sometimes they didn't want to open up if they knew that someone was going to leave them. And so it was always a challenge to try to provide that safety for them.
And if you have
right?
trauma, that seems kind of counterintuitive.
I know it wasn't the
Sure.
best system, but it's the system in residency nationwide. But it was interesting because I inherited a lot of people who were taking benzos like Klonopin or Valium or Ativan every day of their life for the last 20 years, or Ambien. And, you could see through time maybe how these meds were impacting them cognitively. And so it was kind of this hard thing where how do we help them long-term, but also not take away what's sort of keeping them hanging on by a thread as well. So that was always a little tricky. But meds can be helpful. They can take the edge off that hyperarousal, those intrusive thoughts, that hypervigilance. But it's just tricky because there's side effects sometimes, and sometimes they stop working. So it's just a journey. We have to kind of have an ongoing conversation about how people are doing on these meds.
Is it really dependent on the person? Like let's say Jess and I, our body, our composition, we maybe take the same medication, but it metabolizes differently?
Yeah, so there are these genetic tests that exist these days that help psychiatrists understand how drugs are metabolized in a very personalized way. And our livers are all different from one another in that we have a set number of enzymes, and some of them are hyperactive or underactive or normal. And there's a variety of combinations of these enzymes and how active they are. And so everyone has like this unique signature.
That's got to make it so hard to do your job.
Yeah.
Do
How
it.
do you even know?
Yeah. Well, the truth is that there are only a finite list of meds that every psychiatrist has access to. And the meds either work or they don't. And you just march down that list. And you use these genetic tests as a way to kind of further fine-tune how you're doing things. But I would say for me personally, the genetic test isn't scripture. It's not the end-all be-all. But
Sounds like
is-
it's just information.
Well,
It is.
Does it help like eliminate some so you don't have to go through the whole list?
It does. It gives you an idea of what maybe you should steer clear from. But unfortunately, a lot of times people have already tried all the good ones.
Before the test comes.
Right. And then the test comes, and then we're left with all the ones in the red category. And so we have to try those. And sometimes they work. And so it's kind of like, well, was the test worth it anyway? But yeah, it's hard.
I've heard that discussion. Sorry.
No, go ahead.
I've heard that discussion about is the test worth it? The genetic test. Not everyone does it. Some people don't think it's worth it, but it sounds like you use it as a tool.
Yeah. In my experience, I think it depends on the type of person I'm working with. So if they personally feel it's important and they put a lot of value in it and they feel like it's going to be crucial to their journey, I want to leverage that.
Sure.
Because I think that for that sort of person, it will be important. So I take that seriously. Yeah.
I was thinking back to what you were saying when you worked with veterans, how you would only work with them for a short period of time and then you would rotate. And it kind of relates to what we do in IOP. We're with our clients for like a 3-month period, more or less. And then we have to have them go off into their individual therapy who's long-term. You now work with clients more long-term, right? Mm-hmm. So you might see them more and more at the beginning, but you typically follow them for multiple years?
Yeah, it depends. I'm very much open to that. A lot of young adults, go to college out of state. I can't legally see them across state lines, but I follow them for as long as they want to be followed.
That's nice.
I try not to show up at their doorstep pleading that they don't leave me.
You don't move from state to state as they do.
No, well, I have multiple residents for that reason. But I work with people for as long as they want to be worked with.
That's nice.
Yeah.
I mean, that's what we try to do, connect our clients to long-term support, whether it's therapy, psychiatry, community groups, or anything like that. Because we're only a short period of time.
Yeah.
And we know that's what works, is that long-term consistency. It's kind of like working out, right? Like you could get really fit for a marathon or something, but then if you don't keep going, it's gone. And I feel like sometimes that's what we are. We're like that intensive piece of the puzzle, and we really want people to maintain it so that they don't have to get to a place again.
And it's interesting, I've had some clients where they don't actually use my psychiatric services, but they come to me to almost see intermittently if they need my services. It's almost like
checking in.
What do you think of me, Dr. Feeley? Like, do I need medicine? Do I not? And it's sort of like this conversation that is fluid, and it's not like I'm there saying they have to do something a certain way, but it's more like this honest back and forth, letting them express themselves, and it's almost like them expressing their anxiety about possibly missing out on an opportunity to be on meds, and then getting my opinion about it. So it's kind of an interesting thing.
But I think that speaks to the trust that you've built with people, that they want to come back to you to consult. Like, I trust that you're going to tell me either direction what's best for me. So I think that's really beautiful.
Yeah, they know they're tethered to you. So whether they see you frequently or not, they know they can, and that feels reassuring.
You know that rope that the little kids use?
Mm-hmm.
That's what we have in our office, and we all kind of walk out together.
With the little loops on each of them?
That are numbered.
That's nice.
Right.
Make sure we have everyone with
That's
us.
really nice. I'm glad you do that with your young adults.
Right.
What do you think is like the most common misconceptions about meds? Because we get a lot of fear. And I know for me, culturally growing up, and even still to this day, a lot of people in my world are like afraid. Or they're like, taking medication means like you're crazy. Something's wrong with you.
Or you're going to get addicted to it.
Oh, that's the biggest one. Yeah, I don't want to get addicted, so I'm not going to take it. And I know I don't have a lot of room to talk because I don't even like taking Advil when I have a headache. So I'm one of those people that's like really stubbornly in this, I don't know, a little bit of, I guess, fear or some hesitancy about medication and what it does to your body. So,
Well, I think a lot of people see the experiences that other people have on meds, like their friends or their parents, and internalize that as thinking that that'll happen to them. For example, I hear a lot that people will think, well, my friend was very nauseous, or they got more depressed, so like I really don't want to try this. So I think it's really being, it's hard for people to be open when they already have these preconceived notions. And so being able to leave that at the door is hard for any of us. Mm-hmm. It's the same thing like if you hear that a movie isn't so good and your partner's trying to drag you to that movie, you kind of just...
You're hesitant.
Yeah, it's like, well, I don't know. I heard it wasn't good. You know, do I really want to sit for 2 hours through something?
Yeah, waste my 2 hours.
So
that's a really good analogy.
Yeah.
You know, so the power of someone's suggestion and experiences is hard to shake sometimes. I think the cultural piece is tough because a lot of times the cultural piece, you know, you're born into that, and so you're witness to that for many, many years, usually before you show up to a psychiatrist's office. Mm-hmm. So that is deeply conditioned. The myth that meds are hard to get off of, partially true. It depends on the med.
Right.
You know, and I think that's where a more nuanced conversation has to be had, which is, well, which med are you thinking about? Which meds have you heard are hard to come off of? You know, it's similar to coffee. You know, if coffee is helpful for you and you want to get off of it, you won't feel as good for a period of time. And similarly, if a med makes you feel better and you try to get off of it, maybe you won't feel as good for a period of time. But it doesn't mean you can't not be on a med. It just means you have to get off of it in the right way. And I think actually, quickly, just to highlight this, a role of a psychiatrist is also to know how to deprescribe, right? So it's how do you safely get people off of meds? And we're hearing more and more about that because it's trendy, of course, because it's important. There's been a New York Times article discussing this idea of, you know, how do we safely get people off of meds? And it's a skill, it's an art. You know, there can be a lot of people who don't do it right, psychiatrists or patients.
And then people have a bad experience, and then they tell their friends,
and then they think
those
they're
friends
addicted to their meds, and then it's this whole thing. Right.
I think the piece of culture, I mean, that's a big reason that brought me into this field, is just understanding culture and differences, but also similarities across cultures. And I've seen over time, both personally and professionally now, how it's changing. It is changing a little bit. That I think cultures that were not very open are maybe a little bit more open. What do you think?
Yeah, well, you know, actually,
generations. I feel like the new generation.
Absolutely. Well, I think there's more awareness around it through social media. There's no, yeah. I just think there are a new set of stressors with this generation that maybe weren't present with the last generation that are being magnified by social media. And I think it's all coming to a head, especially in our younger population, where there are a lot, there's just a lot more, I think, anxiety because there's a lot more self-preoccupation. And I think that is stressful, through social media. So parents are sort of like wondering how to handle this. And I think also how to navigate the balance of how much time kids can spend on social media and what kids are allowed to do on their own in this dangerous age creates this really complicated parent-child interaction where there can be like this heightened sense of control from the parent point of view and then the child feeling like this lack of autonomy and it creating more stress in the family. It's not like the 1970s or 80s where you could ride your bike down the street and not really worry. I live in a community that's very safe. My 11-year-old daughter wants to go out and I don't want her to. I think she's really young, but she feels strongly about it. So I think that just a lot more stress this day and age, more interesting situations that are arising for families to think about. So
It's true.
I don't know how I got into all that.
No, it's true. I mean, I think about how much information, like 2 generations ago, right? No matter about the cultural background, 2 generations ago, the information about the medication was different.
Right.
Well, the medication was maybe even different, right? Like even you mentioned earlier about what other things there are, like supplements and lifestyle changes that can be added to the prescription, if you will. Some of those things are ancient and have been around a really long time, but maybe haven't been used or thought to be used in the way that we're using them today. Yeah. And I think there's maybe less fear because people have more access to, like you can look it up, right? You could very easily look up the side effects, whereas maybe one generation ago, we really couldn't do that. You had to go to a doctor to find out if a medication is addictive, for example. So maybe that's contributing.
And these medicines have been around for that much longer.
Exactly. Yeah. And more research, hopefully.
Right. Yep. And I would say more and more people are on medicines. And so
there's more data.
Yep, more data. And to your point about holistic things, I think that my experience is that you can't deny the importance of certain practices because they've persisted throughout the ages. And they seem so evident as being helpful, like looking at your breath, going inwards. These things are intuitively, not surprising that they could help you. So I put a premium on this. And one thing I wanted to share that I didn't share about myself was that I actually traveled to India after college. And I was just so interested in that area of the world as far as the origination of these practices. And I studied there for a bit and I became a meditation and breathwork instructor.
Of course.
Yes, of course. And I have to say that's in addition to family, in addition to self-care. I mean, that is, I put a premium on that because if I am not feeling 100%, nothing else will be 100%. And some people call it selfish, but but it's really important to have a way to ground yourself every day. We have a lot of bullets coming our way every single day, and if we don't have a way to deflect all of this aggression that happens around us, it's hard. Mm-hmm.
So how do you do that? Do you have like a morning practice?
I have a morning and evening practice, definitely. So that's the experiential part. And then there's this interesting thing where, like a Rolodeck, when I drive down the highway, I go through these certain key points that are also yogically derived. So they're called, perhaps for a separate podcast, I'll just briefly say that they're called the yamas and the niyamas for anyone who's listening who has knowledge of these things. But there are 10 points in life to get the most out of your life. So these things were delivered thousands of years ago as being the most crucial things to stay grounded and connected to your core. Non-aggression towards others and yourself, verbally, behaviorally, or mentally, right? How we think about ourselves, how we think about others, how we physically treat people, how we physically treat ourselves, how we talk to people. This is a big one for me with my daughter. Sometimes she in the morning getting her ready for school, do I raise my voice? Do I not raise my voice? Do I get too easily upset? So really monitoring my speech.
Wow.
The next one is
I love this.
Truthfulness and honesty in relationships, right? And by the way, I'm going into all this because for me, what I feel like is if we all have a value system, guardrails for how to live our life is easier. It's almost like a moral kind of framework, right? So, and having that, I think, reduces a lot of anxiety. So if we can control our aggression and we can manage to be truthful and honest in our relationships, and we cannot steal, not just physically, but also not taking what's not ours, not being jealous of people, trying to bring them down, right? So non-stealing, non-aggression, truthfulness, restraining our senses, right? So if our senses, our five senses go rogue, like with our phone or with food or with socializing, guess what? It's taxing to our mind, right? So if we have a way to restrain our senses, not like in a severe way, but we have control over them, that's a good thing. And then the fifth one is non-accumulation, which means not accumulating insults, not even accumulating praise. So those are called the yamas.
So you think about all this when you're driving down the highway.
Can you believe it? Yeah.
You also work in addiction, right?
Right.
That reminds me of like what you want to instill in people in recovery.
Yeah.
It's like you're not just trying not to use the thing. It's, are you in recovery with your words and your actions and your behavior? And so all of those points really, that's what I connected to, is it's not about just not doing the behavior of using the substance.
Right.
So, I mean, I imagine hopefully those are the things that you work with your clients on who are trying to.
Absolutely. And I say some of these things and they're like, wow, where did this come from? And I'm like, yeah, I know. It's almost like they're so self-evident that you wouldn't even ever think about them. I'll just quickly go through the last five. It won't take more than a minute or 30 seconds. Please. But those were the social ethics, meaning don't be aggressive towards people or yourself. Be honest. Don't steal. Restrain your senses so you don't get into all sorts of trouble. And don't accumulate things from the environment or insults, all that stuff. Now, the 5 personal practices that I also go through in a Rolodeck in my mind, very important. Cleanliness. Not just taking a shower, but internally, what's going on, right? We have a box within ourselves and what's happening in that box and just being aware of that. Number 2 is contentment. Contentment is really hard because if you wipe everything off the table, all your hopes and dreams and fantasies, expectations about the future, and you can be content with how things are now, who does that? Not many people, right? So thinking about if nothing went my way starting now in perpetuity, can I be content with who I am? I know that a lot of the youth can't, right? Because as a youth myself, at one point in time, I was so fixated on the next step, getting into the college of my choice, or that friend liking me, or that thing happening that I wanted to happen. So contentment. The next one is willingly enduring challenging situations. The key is willingly. The cool thing is thousands of years ago, they wrote challenging situations. That meant that was common to humanity, that they knew that this was just pervasive. So, but willingly, right? Willingly stepping into it, being okay with it, knowing that it's going to happen. The next one is self-examination, being honest with yourself, right? And the last one is faith in something. In yoga, it says faith in the divine, but you could say faith at least in yourself, right? So putting your faith in something either bigger than yourself or yourself, and knowing that you've got this and you're going to be okay. So imagine if you worked on these 10 things every day, meticulously. I took a course where I learned all these things, and there was a survey that said, how meticulously are you doing these things? And before the course, it was a 0 out of 5. And then after the course, I was like, wow, this is so interesting. And so every day I ask myself, how meticulous? And of course I fail, but I try not to be aggressive with myself in that.
Do you feel like some days you're more meticulous than others?
It depends on my energy. And that's where stress management comes in, right? That's where the practice of relaxing comes in. Because if you're stressed out, you're not even going to think to not be aggressive. You're going to be like, pick that up and then like, kick them out the door, So it's, I've never kicked anyone, but so.
Figuratively.
What are ways that you unwind? I mean, I hear that those are your practices, but are there any other ways that you kind of work through all the energy that you hold?
Yeah. So you should see me when I come home. I'm wound up. I'm twisted like this, and then two people get around me and they unwind me. But in all seriousness, now obviously that's a big component of it. I find that going on walks are important. I have a beautiful, loving family who's extremely important for my well-being. My beautiful wife and daughter are just integral for my well-being. I have a very unique Siberian cat who I'm sure some of you out there have a Siberian cat maybe, but she is more like a dog than a cat. But she's so loyal and loving and emotional, and she even gets overtly depressed if I don't give her 15 minutes twice a day of undivided playtime.
She's probably banking on your energy. Literally.
Maybe. But
what's her name?
Chia.
Chia.
Yeah.
Chia.
Shout out to Chia.
Yeah, shout out to Chia. She's not listening right now, but it's okay.
She'll know you talked about her.
Yeah. But it's also outlets like this, being around particular people, an amazing social community of like-minded people who value the same things that I value. So surrounding yourself with an uplifting group of people is very important for all of us.
And I think that's hard to find sometimes. Because
good point.
I really do like those 10, what would you call them? Tenants?
Yeah, you could say tenants. Yeah.
I like them because they're all very attainable.
Yeah, practical.
They're practical, and you can tell they've been around a really long time. And there's something comforting about that for me.
Yep.
That it's not like new. It's not like this new idea. It's just, it's really ancient.
Yes.
And part of what I related to is there was one about just like that really feels grounding, which is to just kind of let things roll off, essentially, is how I translated it. One of my old supervisors used to tell me to imagine like a cloud, like a cloud. Like sometimes when people are mean or jealous or like, treating you badly, that it could be, it could come at you and it could go into you and it can just tear you down and weigh you down. Or you can imagine it like a cloud and it goes through you and to, behind your chair and over to the next thing, like a cloud does. Yeah. And that image has really helped me to have a little bit more of that you were describing, of not accumulating. That was the one.
Yep.
Not accumulating the bad, if you will, and just letting it kind of go, because life keeps going.
I hold like a rock in my pocket when I'm at work the whole day. Sometimes it's a different item, but it's always an item, and then I leave it in the office when I leave. And so for me, it's like everything is like going into that rather than into me.
I love that.
Yeah.
I didn't know you do that.
Yeah. I talk about it with associates and stuff in trainings, but.
And you leave it at work.
Yeah.
So it doesn't come
There's a stone wall outside.
That's why I throw them.
Explain it a lot.
Yeah. But it's just something that like is tangible, that I can imagine everything being in.
And you leave it
and I
there.
just leave it and it stays there, and it's also like for all of my clients to know that like I'm holding it, but I'm not carrying it around with me.
It's good role modeling.
Yeah.
I love that. I used to have a colleague that would wash her hands before leaving as a figurative, like, and I'm leaving everything here and I'm going home with freshness.
I mean, I think that that's what our therapy rooms like are to our clients, is this space where they put it all in and then they get to leave and they just know it's there. My little clients think I sleep in my office. They're always like, "Where's your bed?"
Yeah, because you belong there.
Yeah, because that's
like
what they know.
You know, when you were little, I remember running into a teacher outside of school and being like, "But you're not in your classroom. That's where you belong." That's, I guess, how it is for us too, especially with the littles. I really appreciate learning more about your learning.
Yeah.
Because, when we're in meetings and we're consulting about a case, we don't get to have this level of conversation. And
Although it shows through
totally,
all of our interactions.
Thank you for that qualification.
None of it is surprising.
Agreed. But like, what a pleasure to have the time to like learn more and then to share it hopefully with people that maybe will gain something from it as well. That's our hope.
Yeah,
is that
for
we
sure.
can share the wealth that we get to have.
Yeah, this is universal knowledge, and it's a wealth to be distributed to everybody.
And sometimes it's interesting to just think a little differently for a minute, you know? And when you describe that, I would say it's not so different than what I try to do, but it's certainly different in how structured it is and how, like the word meticulous. Like I would say I am not meticulous.
It's always stuck with
any
me,
of
that word. Yeah.
Yeah, because it you know what it is? It shows the dedication to it, I think. And it's probably like with anything, the consistency that makes it so powerful.
Absolutely.
When you joked that people see it as seeing it as selfish, but you're not just doing it for you, you're doing it for everyone else.
That's right.
So it could also be selfless.
That's right. No, that's why I'm doing it.
Yeah.
I wouldn't be doing it otherwise.
Yeah.
Yeah, it's directly impacting all my family members, all my patients, everyone I interact with.
Us.
So you guys,
100%.
I haven't thrown my famous left hook yet.
At least it's your left hook.
Yeah,
Right.
on my side.
Right,
My side.
exactly.
It's all me. I mean, no,
Do you want to sit over here?
I
No,
will
it's okay.
say that, you know, there's been tough times and tough days, and your presence does ground me when even if we're not talking about what's all the other stuff that's happening. But I will say that over these years, you know, my family and Engage have gone through stuff. And when you come in and you're joining us in a meeting and just the way you say hello and your walk, it's grounding and it feels safe. So I appreciate it. And
Well, it's whenever I walk by the stone wall, it's somehow my walk actually
You're
changes right before I go.
You're welcome.
But thank you.
Yeah.
yeah. Well, thank you. I don't know if you guys have
No,
more.
that was wonderful. Thank you so much.
You're very welcome. It's been a real pleasure.